Begin the harvest by making a 3 cm vertical incision at the superior pole of the patella. Use the guide track to blunt dissect to the tendon up to the 0 laser mark. With the guide track mated to the Q-view retractor, place the 0 mark on the guide track at the superior pole of the patella. Identify the transition of tendon to muscle and estimate the available graft length. Mate the track cutter onto the guide track and make the longitudinal cuts on the tendon. Remove the guide track, continue the longitudinal cuts to the patella and strip the distal end of the graft, dissecting to the desired graft thickness. Begin preparing the implant. Remove the ultra button quad from the card by pulling on the needle. Continue pulling the sutures off the card until only the sutures on the reverse side are left attached. Remove the smaller card from the larger card, leaving the sutures intact to aid in suture management during graft preparation. Pass the needle top down through the graft at the 15 mm mark. Pull all suture through the graft until the titanium button is close to the surface of the graft. Create a luggage tag by forming a loop with the co-braid sutures and pass the suture card and graft through. Pull from the titanium button to cinch the sutures around the graft. Pass the needle top down through the graft next to the luggage tag on the tibial end and pull the suture tight. Move the suture management card towards the clamped end. Split the 2 suture limbs around the graft, then pass the needle top down through the graft and pull the sutures tight to create a whip stitch. Repeat at least 1 time. Pull the construct slightly past the marks and use the white suture to flip the ultra button quad on the femoral cortex. Attach the provided reduction bar to the ultra button quad by sliding the reduction tails finger loops into the J-shaped channels.